culture. Okay, so if you've cut, poisoned, or burned your body or your table, let's fix the table. Let's restore the health back to our body, and let's clean out the house. Okay, let's clean out the house, and we're really going to talk about today about how to clean out the house. So, history of chemo, really quick here. Okay, chemo was a warfare used. It was mustard gas used in World War I. Most of you hopefully knew that. If not, it probably makes you sick now. So they found that these guys were coming back from World War I with no hair. Their skin was bad, they had no hair, they lost their eyebrows, all these things like that. So they did more and more research on this, and they found, well, wait, the mustard gas and the chemical warfare, the chemotherapy, which hasn't changed a lot in the past 70 years, right, has actually affected our fast-growing cancer cells, meaning our fast-replicating cancer cells, okay? Now, what's more important, the fast-replicating cancer cells, or how about the stem cells that actually create the cancer cells? Stem cells that create cancer cells. That's what's more important. So if we just cut off the symptoms or burn or poison the symptoms, which is the small, fast-acting cells, then we think our tests are good, and then we never address, well, wait, there's an underlying stem cell issue that's now creating the cancer cells. Then what's going to happen 5 years later usually? They go back for a test, and what happens? It's back. Because it looked good with the small cells were gone, and then we forgot to go after the stem cells, okay? Here, this is probably hard for you guys to read, so I'll just read it to you. How effective is chemo? Now, this is from the Clinical Oncology Journal, December 2004 issues. It says the effectiveness, the percentage survival rate of effectiveness of chemo after 5 years was 2.1%. Why is that? Now, if you've had chemo, you're not doomed, but listen to this. Majority of our culture, majority of Americans, when you get chemo, the test looks good, they don't change anything. They go back to what caused it, you see? That's the majority of the people. That's the majority of people. So understand it is 2.1% survival rate after 5 years to show the effectiveness of chemo, right? Chemotherapy side effects, you guys know it's bad, it's poison. It's considered poison to the body, right? That's why it kills almost everything in the body, okay? But one thing, as I was doing more research with tamoxifen, which is one of the most prescribed breast cancer drugs out there, you're on it for a minimum of 5 years. That's what Susan G. Komen says on their website. You're on it 5 years, which think about that. Even if you're trying to live a healthy life, if you're on tamoxifen, what's it doing to your immune system? Strengthening or weakening it? Weakening it over time, right? But it gives us that sense of hope, right? And you're not a bad person, right? The same thing goes for cholesterol drugs and blood pressure medication. Hey, I'm good, my numbers are good. Well, you're taking drugs, that's why they're good. You didn't fix anything, right? So it's not just tamoxifen, and so if you're on that, don't feel bad about it, but understand it's the cultural thing that you take a drug to hide a number, and we think we never ask the cause of what got us to that number. You with me? So listen to this. I mean, this is from the FDA, okay? The FDA, it's a known carcinogen, tamoxifen, which causes what? Cancer. That's what carcinogen means. It's not a guess, it's not an estimate, it's not a maybe, it's a known carcinogen. 100% of these drugs are poisonous to the body. Go on Susan G. Komen. I did this morning, okay, to test myself. And I looked up tamoxifen, okay? And then I looked down, it was like 99% good stuff. And guess what? They had a side effects tab that was hidden. I hit the side effects tab and it said, side effects for this aren't really known yet, but if you really want to know the research behind it, click on this link. So I had to go to a whole nother website to find, yeah, it's carcinogenic, it's actually not good for you, these are the side effects. So guess what? We're being lied to. It's hiding right in front of us. It's hiding. But guess what we got to do? We just got to look for it. We got to start to look for these things. And I don't want everyone to be skeptics of everything and not-for-profit, because I'm there a little bit, but you can drive yourself crazy. I don't want everyone to think that everyone has a bad heart. I don't want that. But all I'm going to say is this: there's money behind stuff. That's all I'm going to say. And you do your own research before you make a decision, okay? But when something is carcinogenic, why would you take it when you're trying to prevent and fight cancer? It just doesn't make sense, right? Sickness isn't a moneymaker, okay? And this isn't just cancer drugs. This isn't just Susan G. Komen. Let's look at some other ones. So Johnson & Johnson, their marketing budget is $17.5 billion to us. We're one of 2 countries in the world where we can be marketed to on media, meaning radio, TV stations, and also magazines. One of 2 countries, us and New Zealand, are the only ones in the world. So guess whose fault it's not? It's not your doctor's fault. I want everyone to hear that loud and clear. We have a lot of medical doctors, pharmacists, believe it or not, nurses, as patients in our office, and they'll sit here and they'll nod their head because they agree. It's not their fault. I'll ask the primary medical doctors that I know and the surgeons that I know, like, hey, why is there such a disconnect? Why are people okay with just continuing to be sick and medicated and continue to get these diagnoses year after year? And they said this: they're just not willing to change. See, there's two problems that I have. Either one, you don't hear the information and you perish, right? People perish for lack of what? Knowledge. So information applied with action turns to knowledge. Knowledge just doesn't come from you sitting and listening to me today, okay? We got to change, right? So that's problem number one. If people don't hear, right, then they know no other way, okay? The second problem, though, is this, is when people hear another side of it or another truth and they just accept what they've always been told. See, that's my problem. And that's where medical doctors and with all these different drug companies, things like that, they're preying on people that like will hear something and then not change. Who knows somebody like that? No, there's more people out there, right? My family members, they know who I am and what we do and we talk about. They know the research, but guess what? Oh, it's just Nick, right? It's just maximized living. I'll just listen to my white coat doctor, right? Listen, I'm serious, right? And so once again, it's not the doctor's fault. But Pfizer puts $11.4 billion into marketing. They put $4.4 billion into research. I can't even say the last one. I don't want to say it. $7.3 billion in marketing, $4.3 billion in research. You guys, it's changed since when you were kids. People 50 and over, it's changed since when your parents were kids. Things have changed, and if you notice it, you're exactly right. You're not going crazy. Things have never used to be this way. A doctor used to say, take 2 and call me in the morning, right? Hey, you have aggressive cancer, but we're not going to do these types of treatments on you because I just don't think you're strong enough to do it. And guess what would happen? They would actually live past the expiration date. I'm serious. So surgery, let's talk about this really quick. Growing evidence suggests that cancer surgery may increase the risk of metastasis. It increases cancer cell adhesion, suppresses the immune system. Anyone who goes through any surgery, I want everybody to hear that, it will suppress your immune system. Why? Because our body has to heal. So if there's something that we got to heal from, we're taking away from what we're trying to do is over here is kill cancers and kill viruses and bacteria. If there's an underlying virus like HPV or Epstein-Barr or even the chickenpox and all these different things out there, there's these viruses in our body. If our body's having to always try to fight that, then I call it a kink in the armor. Okay, it's a kink in the armor. If we've had organs removed, guess what? You were born with the perfect amount of organs that you need, right? There's a place if it's a surgically needed, if it's a crisis, I get it. But what's happened is now you take an organ out, you put an added stress on the body, therefore your body has a hard time fighting off anything, right? Think about that. So we were born perfectly, but I get it. If there's a need for surgical intervention, I understand, but understand it will weaken your immune system, okay? Promotes angiogenesis, write that name down. Angiogenesis, write that down, take a picture of it. Angiogenesis, that has been proven from research that surgery on cancerous sites does create angiogenesis, which is pretty much it's your body saying, okay, now since we had surgery, we got to create more blood vessels immediately. So it's fast growth of new blood vessels, which essentially is a highway to the rest of the body. Raise your hand if you know somebody who had surgery on a cancer site and it metastasized to the rest of the body. Anybody know somebody like that? Okay, I know a lot of people like that, okay? I'm not saying the surgery caused it, but understand we weaken the body, angiogenesis happened, and then also we become inflamed. Okay, surgery will cause inflammation in our entire body, okay? So we got to watch out for that. Radiation, most of you guys know it's not good. It actually weakens the immune system. It burns tissues surrounding the cellular cells, and what happens is that, once again, it puts a kink in the armor. It allows us not to be able to heal. And if it's burning other tissues, that's why the doctor said, my goal is to get him to not die from cancer, but a stroke or heart disease or diabetes. I mean, did anyone catch that? Just realize how wrong that is? Yeah. Like, how about, hey, my goal is to get them healthy and stay healthy as long as we can. But the problem is this, is that the doctor's not bad, right? He's doing what his niche is, what his specialty is, but our whole system doesn't tell us how to live a healthy, long life and disease-free, right? They don't get paid for that. Guess what doesn't pay for that? Medicare or insurance. Shocker, right? Doesn't pay for that stuff. Pays for crisis care, maybe, okay?